Hello everyone, let us start today with different triads given in our uh, practice of medicines and very important for our AIPGT examination. Okay, let us first start with what is Baker's triad. Baker's triad is related to cardiac tamponade. It's related to heart. Okay, so what will be you see in triad will be jugular vein distension, muffled heart sound, and hypotension. In Baker's triad, you have hypotension, jugular vein distension, and muffled heart sound. Key point is there is decrease in preload and decrease in stroke volume. Pulses paradoxes may present. Okay. Now let us talk about Wernicke's encephalopathy. In Wernicke's encephalopathy, it occurred due to deficiency of vitamin B1. In this, the triad will be confusion, ophthalmoplegia, and ataxia. The key point is neurological emergency and treat with thiamine, IV of thiamine. Wernicke's encephalopathy is related due to vitamin B1 deficiency, and you will have confusion, ophthalmology, and ataxia. Then we have carrot triad. Carrot triad is for cholangitis, that is bile duct obstruction with infection. You will have fever, jaundice and right upper quadrant में पेन होगा. इसमें क्या होगा? Bile stasis plus infection and it may progress to Reynolds Pentire. Okay. Now what is Reynolds Pentire? Carrot's triad plus shock plus altered mental state is give rise to Reynolds Pentire. It is that is severe cholangitis with systemic involvement. It is a medical emergency. Okay. Now classic migraine triad. When you will tell it is a migraine. When you have an aura, have a unilateral headache, and with headache you will have nausea and vomiting. Okay. Neurovascular dysfunction and cortical spreading depression. Throbbing headache, often unilateral. The trigger might be stress, hormone or certain foods. Normal pressure hydrocephalus. Hydrocephalus means what will be there? Therefore impaired CSF absorption and ventricular enlargement. So what will happen? Your head will enlarge. There would be water filled in your brain. That is hydrocephalus. What will happen? There would be dementia, gait disturbance and urinary incontinence. Reversible cause of dementia. Triad is dementia, gait and incontinence. Okay. What is myasthenia gravis triad? Myasthenia gravis is an autoimmune disease which attack on acetylcholine receptors. Okay, that is neuromuscular junction. So what happen in this? There will be a muscular fatigue, there will be ptosis, there will be diplopia. What will happen in Guillain-Barré syndrome? Guillain-Barré syndrome, you will have an ascending paralysis. It is also an autoimmune syndrome. In this, paralysis will start from your legs and then ascend to an upper body. There would be areflexia, means your reflex action would be absent, and CSF protein will increase. This is what acute autoimmune demyelinating polyneuropathy. Okay. What is nephritic syndrome? It is itic. Itic means inflammation somewhere. So it is what? Granular inflammation. So in inflammation you will have hematuria, that is blood in urine, hypertension and oliguria. Okay. There will be RBC cast, proteinuria, edema. What will be the cause? It could be PSGN or IgA nephropathy. Then we talk about nephrotic syndrome. In nephrotic syndrome, as we have discussed, there is A. So it is related to protein loss. So you have protein loss will be there. Increased glomerular permeability, that is protein loss in urine. What is a triad? Triad is proteinuria, edema, which is generalized, and hypoalbuminuria. Additional feature what you will have? There will be hyperlipidemia and lipiduria. What do you mean? What is a triad of hyperthyroidism? When you will say there is hyperthyroidism, hyperthyroidism means your body basal metabolic would be very fast. If excess of thyroid hormone cause increased metabolism, it will affect multiple systems. As of therefore heat intolerance, there would be weight loss, there will be palpitation, overactive thyroid. Okay. What is pheochromocytoma? Pheochromocytoma triad is what? Catecholamine secreting tumor causing episodic surge. It means it is a tumor of catecholamine. There is a certain tumor which release excess of catecholamine. So it is a tumor which release adrenaline with surge, which cause a triad. There will be headache, sweating, and palpitation. Headache, sweating, and palpitation. Okay. What is Addison's disease? Addison's disease means adrenal cortex insufficiency causing deficiency of steroid. Adrenal cortex is not working very perfectly. So there is a loss of cortisol and aldosterone. What will be triad? There will be hyperpigmentation, hyponatremia, and hypotension. When we call an hypercalcemia, there will be elevated calcium level. So if there is elevated calcium level, there will be a renal stone, there will be bone pain, and there will be what? Abdominal or psychical symptoms. What is aortic stenosis? That is narrowing of aortic valve outlet tract. Means this is a artery, and there will be deposition. So there will be a narrowing. Okay. Key point will be obstruction, angina, syncope, dyspnea. Angina, syncope, and dyspnea. What would be in hypothyroidism? Hypothyroidism will be just as opposite of hyperthyroidism. There will be cold intolerance, there will be weight gain, there will be fatigue. That is underactive thyroid. Means your body metabolic rate will be decreased. Okay. व्हाट इज कशिंग सिंड्रोम? कशिंग सिंड्रोम में हम याद रखते हैं अनंत अंबानी को। तो अनंत अंबानी जी का भी वही है कि इसमें क्या होता है, एक्सेस कॉर्टिसोल लेवल होने लग जाता है। तो एक्सेस कॉर्टिसोल लेवल की वजह से आपका मून फेस रहेगा, बफेलो हम्प रहेगा और पर्पल स्ट्राइप्स रहेंगे। व्हाट इज डायबिटिक कीटोएसिडोसिस? दैट इज डायबिटीज मेलाइटस 1 टाइप 1। इसमें क्या होता है, इंसुलिन की डेफिशिएंसी हो जाती है, उसकी वजह से क्या हो जाता है, हाइपरकैल्सीमिया एंड कीटोसिस। कीटोसिस की वजह से क्या होता है, एसिडोसिस, hyperglycemia and ketosis. Okay. What will happen in hypocalcemia? Hypocalcemia means there is a calcium level very much decrease, so there will be Chauvistic sign, seizures and tetany. What will happen if there will be left heart failure? In left heart failure there will be orthopnea, paroxysmal nocturnal dyspnea and dyspnea in general. Okay. What will happen in right heart failure? Right heart failure, you will have hepatomegaly, you will have peripheral edema, you will have jugular vein distension. When do we call an asthma? Asthma is first of all reversible airway obstruction leading to an episodic symptoms. There will be dyspnea, cough, wheeze. Okay. When do we call pericarditis? Itis means inflammation, pericardium means peripheral wall. So inflammation in pericardium called a characteristic. There will be pleuritic chest pain, pericardial rub and diffuse ST elevation. What is TIA? That is transient ischemic attack. Temporary interruption of blood flow to brain causing a transient symptoms. Means in brain we don't have blood sugar level stored. So it need proper amount of oxygen. If oxygen demand will be less, so there will be focal neurological deficit resolution within 24 hours and no infarction. Okay. What is COPD? COPD is first of all chronic obstructive pulmonary disease. What happened in this? There is chronic airflow limitation cause classic respiratory symptoms. There would be cough, sputum and dyspnea. What happened in pneumonia? Lung infection cause inflammatory response and consolidations. There will be cough, there will be fever, there will be consolidation. What happened in Parkinson's disease? Parkinson's disease is a neurodegenerative disorder causing classic motor symptoms. There will be resting tremors, rigidity and bradykinesis. What will happen in subarachnoid hemorrhage? Subarachnoid hemorrhage means there is bleeding in arachnoid space, which is a sudden severe symptoms. So there will be a thunderclap headache, neck stiffness and vomiting. What will happen in bacterial meningitis? Acute inflammation of meninges due to bacterial infection. Okay, so there will be fever, there will be neck stiffness and there will be AMS. What is Cushing's triad? That is late sign of increased intracranial pressure. There will be hypertension, bradycardia, and irregular respiration. Cardiac arrest, that is cessation of heart function due to various causes. There will be pulseless, unresponsive, and anemia. Means cardiac arrest means your heart have stopped working. Hypoglycemia, that is low blood sugar level affecting brain and body function. So they would be low. Whenever you have low blood sugar level, you will have confusion, tachycardia, and sweating. Okay. What happened in pulmonary embolism? Occlusion of pulmonary artery causing impaired blood flow. So there will be chest pain, there will be tachycardia, there will be dyspnea. Hyperkalemia, ECG change, elevated serum potassium level affecting cardiac function. So what will be happen if there is a elevated serum potassium level? There will be tall T wave, wide QRS, and sine wave. Okay. A raised ICP, that is intracranial pressure. If your intracranial pressure will rise, you will have vomiting, morning headache, and papilla edema. What is vitreous triad? Vitreous triad is affecting a contributing to deep venous thrombosis. There will be hypercoagulability, there will be endothelial injury, there will be venous stasis. What is Horner syndrome? That's a disruption of sympathetic pathway to eyes. So there will be meiosis, ptosis, and anhydrosis. What will be hypokalemia? If there will be hypokalemia, then will you have U wave, ST depression, and flat T wave. What happened in acute pancreatitis? There will be inflammation of pancreas causing systemic symptoms. There will be epigastric pain. There will be high enzyme, that is serum amylase, serum lipase, and pain to back, which is a radiating pain. What is Whipple's triad? Classic triad of symptomatic hypoglycemia. That is symptoms, relief with glucose, and hypoglycemia. That is triad related to hypoglycemia. Okay. What is Dulof's triad? It is related to GIT. That is, there will be massive bleeding, no ulcer, and large submucosal artery. What is Saint's triad? Very often asked. There will be vomiting, abdominal pain, and abdominal distension. You should remember Saint's triad is related to intestinal obstruction. So if your intestine are obstructed, simple. So there will be vomiting, there will be abdominal pain, and abdominal distension. What is Meniere's disease triad? Meniere's disease is related to internal ear. Okay, inner ear. So there will be hearing loss, tinnitus, and vertigo. What is your Hutchinson's triad? Hutchinson's triad is your congenital syphilis. So there will be Hutchinson teeth, deafness, and keratitis. Okay. I have read somewhere that a person said, remember it as गांधी जी के 3 मंत्र, बुरा मत बोलो, मत बुरा मत बोलो, बुरा मत सुनो, बुरा मत देखो. Okay. What is reactive arthritis triad? Reactive arthritis triad is urethritis, arthritis, and conjunctivitis. Triad following genitourinary or GIT infection. What is appendicitis triad? In appendicitis triad, you will have vomiting, fever, and right lower quadrant pain. Okay, over here. What is Burgos triad? It is related to hollow viscous perforation. There will be abdominal tenderness, board-like rigidity, and abdominal pain. What is Gerdingo triad? Is nerve palsy, otorrhea, and severe ear pain. What is Samter's triad? Samter's triad is related to respiratory disease. So there will be nasal polyp, aspirin insufficiency, and asthma. Vogel's triad is retinal scar, vitreous inflammation, and chorioretinal region. Very important Cartigner syndrome we read in our COPD. That is, it is a primary ciliary dyskinesis, means your cilia stop to work, their movement is stopped. Inherited disorder of cilia motility. So there will be what? Bronchiectasis, chronic sinusitis, and sinus Inverses. What is congenital rubella syndrome? It is an early pregnancy causing multisystem congenital defect. There will be cataract, deafness, and PDA, that is patent ductus arteriosus. What is preeclampsia triad? Hypertensive disorder of pregnancy with multi-organ involvement. There will be proteinuria, there will be edema, there will be hypertension. Very important. What is Weger syndrome? Weger syndrome is related to deletion of chromosome 11, P and 13. There will be genitourinary anomalies, there will be developmental delay, and there will be aniridia. What is Sheehan syndrome? It is related to postpartum pituitary necrosis due to severe hemorrhage leading to hypopituitarism. There will be failure of lactation, there will be agalactoria, amenorrhea, and hypothyroidism. What is ectopic pregnancy triad? There will be amenorrhea, there will be abdominal pain, and vaginal bleeding. Hope you would like it. Please do remember each and every triad. They are very important.